So my test is the posterior sag sign. The whole purpose of this test is to test for a PCL tear, or yeah, pretty much a PCL tear. So you're gonna have the patient supine, so actually we'll need to lay on your back. So you're gonna have their hips flexed at 45 degrees and their knees bent at 90 degrees. So just like this, with their feet flat on the table. Or sorry, I actually just need that one. You can relax that one. Okay. So for the patient, all they need to do here is just be in this position, and they need to completely relax their quads. So just try to relax your leg as much as possible. So in order to assess this properly, you got to be level with the knee, just like this from the side. And all you're looking for is to see if there's a drop of the tibia.
I have the
down.
Thomas test. What I'm going to be testing for is like muscle tightness, and we're going to be able to locate where the muscle tightness is. So what you're going to do is have your patient lay supine. Go ahead and reach down. We want the patient's buttocks as close to the end of the table as possible.
I can do that.
Thank you, ma'am. Yes, yes. And you're gonna bring both of your legs up to your chest. Yes. And you'll slowly lower one leg down while keeping the other one where it is. Okay, so this would be a negative because her leg is all the way flat. Now if her leg was coming up like this, she would be positive for tight rectus femoris. And if it was up like this, she would be tight for hip flexors or the iliopsoas.
2, 3.
Hi y'all, I'm going to be teaching y'all about Lockman's test. So Lockman's test is testing for ACL integrity. So if y'all want to come closer and watch. So what you're going to be doing is you're going to put the patient in supine, so go ahead and do that. We're going to have her relax her other leg, and I'm going to put this leg in an open pack position, so about 20 to 30 degrees of flexion. So what I'm going to do is I'm going to stabilize the femur, and I'm going to put my hand underneath the tibia right here. And all I'm doing is I'm going to do an anterior translation. So I'm doing an anterior translation to the tibia while stabilizing the femur. She has a negative because if it was a positive, you'd see the tibia start to protrude out, or you'd feel a squishy end feel.
All right. I have the varus and valgus stretch test, as everybody is familiar with. That I had it before with the elbow. So what you're going to do is you're going to lay your patient supine. All right, so this tests for damage or instability in your ACL or LCL, or your PCL too. So we're going to perform the test twice. It's going to be first test with your knee fully extended, and the second test is going to be with a 20 to 30 degrees flex. So for the valgus test, you're going to stand on the outside of your patient. You're going to take your distal hand, put it around, stabilize the ankle on the medial side, and you're taking your proximal hand on the knee joint, pushing it in medially. Pain. She has no pain. A positive indication would be pain or an increased movement or a diminished endpoint for valgus. Fully extended, if there is a positive and fully extended, it is going to be your ACL, your PCL, and the posterior medial capsule or your knee. That's what's going to be damaged. So now you're going to do the test again with your knee flexed 20 to 30 degrees. Doing it again. If there is pain or increased movement, diminished endpoints, it's just going to be your MCL if it's flexed. Fully extended, MCL, PCL, and posterior medial capsule, flexed, just MCL. Vice versa, there's sitting inside, stabilizing outside of the ankle, pushing your proximal hand inside the knee, pushing out, same thing, pain or increased movement or diminished endpoint. Fully extended is LCL, PCL, and arcuate complex. 20 to 30 degrees flex, it's just the LCL.
You want to have the patient hip at 45 degrees and the knee at 90 degrees. You want to keep it flat. But you can actually come a little bit closer towards me. You don't have to do this, but it kind of helps for you to gently sit on their foot for stability. Don't put your full weight, what we're gonna do is just gently, for anterior, we're just gonna bring the knee forward. If there is excessive movement, that's positive. So for anterior, you just move it forward, and for posterior, you just move it backward. And as you can see, there's not much movement, so it's negative.
Thompson test. This is going to test for an Achilles tendon rupture. For the test, you're going to have your patient lay prone with about half their lower extremity off the table, their lower leg. And then for this, you're going to squeeze the muscle belly of the gastroc and soleus. If they plantar flex, it's negative. If they don't, they're positive, and their Achilles is ruptured.